Hey friends, welcome to 1 Minute with Monet, a podcast where we help busy adults live life with balance and harmony 1 minute at a time. Before we get into our discussion, let's listen in to our quick tip for the week. Hey friends, in this edition of 1 Minute with Monet, I am here to encourage you to take care of your heart. February is American Heart Health Month, and the things that we can do to take care of our heart include a little bit of meditation. I have my gratitude journal here. Know your numbers. So I have a cuff here to check my blood pressure so that you can be more educated about what your numbers are. So when you go to the doctor and your blood pressure may be a little bit elevated, you can be equipped to know whether or not those numbers are regular or if it is a pattern that you see. The other thing that you can do is to make sure that your nutrition and your physical activity are up to par. So take care of yourself. Remember to do all the things because we want you here for a very, very long time. Until next time, be well and be balanced. Hello and welcome to 1 Minute with Monet. We are going to dive a little deeper into heart health today. Now, February is American Heart Health Month, and the first Friday of February is National Wear Red Day. And I'm here with my guest, Dr. Lindsay Silas, who she and I are wearing our red because we are supporters not only of Heart Health Month, but we are observing National Wear Red Day. Lindsay, tell us about yourself.
Well, thank you so much for having me on the show. I am an obstetrician gynecologist in private practice in Houston, Texas, and I am really interested in treating the total woman. And so when I discovered that you were going to address this topic about heart health in women, I definitely wanted to partner with you to kind of talk about how heart disease looks different in women compared to men. And so I worry that women's symptoms often will get overlooked. But B, to talk about how even a gynecologist can really take care of a woman, even if it has nothing to do with pregnancy or contraception. So thank you so much for having me on the show. I'm very honored.
Thank you so much for being here. And yes, to my audience who might be wondering, why do you have an OBGYN on your show to discuss heart health? Thank you for clarifying that. But that is one of the reasons why I invited you here, because of your passion and your holistic view of how to treat the entire woman. When do you think you became passionate about that and not only staying in your lane, operating in a silo, so to speak? What made you become passionate about treating and caring about the entire woman?
I think one of the odd things about my specialty as obstetrician gynecologist is we are kind of tasked with taking care of the entire person. If you think about it, a heart doctor only really addressed the heart. A kidney doctor only really addressed the kidney. And then someone decided someone needed to take care of the whole woman. And so that seems like odd because a woman has those same organs, but I should take that as a badge of honor. Like I am tasked with taking care of the complete woman. And so I think in my training, I realized like, okay, I'm supposed to care about everything, but I also feel like I knew early on in my career that I wanted to deliver wellness and I wanted to be a partner in wellness for a woman's lifetime from adolescence till her reproductive years ended. And one of the things I found very frustrating when I was in my first year of private practice almost 13 years ago was, how can I give a life makeover in just 15 minutes? Mm-hmm. Like, I feel like I learned pretty early on, it's going to take longer than that for us to get our wellness goals achieved. But I definitely feel like from the start, I knew like, I don't just want to take care of a woman from belly button down, right? While those organs are important, while I'm happy to help take care of you for those things, I realized that the number one killer of women was heart disease in this country. And so if you're not talking about heart disease with every doctor you encounter as a woman, I think things can get missed. So it's really important to me to make sure that even if I'm not the doctor that's specific for hypertension or cholesterol, that I'm at least helping to connect the dots and helping to build wellness teams to get you the care that you need.
Absolutely. And I think that's really important to at least start the conversation And so even though you may not be able to treat some of those symptoms or issues that someone may have with heart disease, you can facilitate building that team so that they are being taken care of.
Absolutely.
And as you,
Why did we get you up?
I was going to ask you, as you mentioned, heart disease is the leading killer of men and women in the United States, and it actually accounts for 32% of deaths worldwide. And that statistic is just so alarming.
Sure.
When you think about that, what are the risk factors? How can we take better care of ourselves in order to adjust some of those statistics?
One of the things I always like to start with are just the vital signs, right? Very rarely would you go into a doctor's office these days and not have a blood pressure taken, get on a scale, have your heart rate or your pulse detected by the machine, and in certain cases, maybe even a temperature taken. I always like that to say, okay, like where are we at compared to last year or 3 months ago or whenever we were seeing. So let's start with blood pressure. I think a lot of people don't know what a normal blood pressure is. And so I always think we can be helpful as healthcare providers to say, look, according to the American Heart Association, your blood pressure is supposed to be less than 130 for that top number, which we call systolic, and less than 80 for the bottom number we call diastolic. So I think a lot of folks are like, wait, what? And they'll be like, oh, my blood pressure is okay. And I'm like, actually, my friend, it's not quite at goal. I think what people get scared about is they worry that they're going to be put on medications and that they're going to suffer side effects of that. And they feel like it's a slippery slope. Now I can't get off that medicine and I'm having this lifelong kind of chronic illness and this label. And I always tell people, let's not get caught up in labels. Like I often tell women, I don't know that I'm the one that gets to decide if you have chronic hypertension or not. But if I find that the vital signs abnormal, we shouldn't ignore it.
Correct.
We should maybe get to the bottom of it. Sometimes it's sodium in your diet. Maybe that's an opportunity to reduce that. You want food that's flavorful. You want to have a culinary experience, but you don't necessarily need the sodium to raise your blood pressure or cause swelling. I also say, we really are looking for patterns. So one abnormal blood pressure, I don't know, actually get you a diagnosis. But if we're finding every time you come in, it's abnormal, then now I'm concerned. And I'll have patients say, oh, it's because I was running up the steps. Or, it was traffic on the highway. Okay, your blood pressure is supposed to fluctuate throughout the day, but I don't know that it's ever supposed to be consistently 150 over 100. And so I think people sometimes take it really personally, like, no, you're just trying to label me, or no, I was doing X, Y, and Z, and that's why it's abnormal. I would rather submit your brain is at risk for stroke if you're having persistently elevated blood pressures. So maybe let's get out of our feelings about it and do something proactive to reverse those numbers, which sometimes can be done without medicines, right? Not everyone who has chronic hypertension needs medicine, but to ignore it or put our head in the sand doesn't seem productive. So let's start with, do you have a blood pressure cuff at home? Can you monitor yourself? I prefer the arm cuffs compared to the wrist cuffs. And I often tell people, I don't really care if you check on the right or the left, but we are different. So if you're always going to get a lower reading on your left compared to the right.
Not know that.
It never tells you, right? So be consistent. It's just kind of how we're made. It's nice if your arm is at heart's level on a counter. It's nice if you're not speaking and if your legs are uncrossed. So, maybe you're getting readings that are normal because you got the wrong size cuff, or you're consistently talking to the medical assistant that puts you in the room. So small things like that, I think, can make a big difference. So I want people to know their numbers, right? And if they're abnormal, don't get scared. Let's do something about it.
Right. Now, do you recommend that we check our blood pressure frequently and not only during an annual physical or an annual exam?
I would say yes. Because think about it. You might get an annual once a year. You may have like a work experience where they're like checking your numbers, or you might go to a health fair in your community, maybe your OB/GYN office, but otherwise you're not checking very often. And that paucity of evaluations could be dangerous, right? You could go 6 months without knowing that it's high. So for example, with my pregnant patients, I tell people, put a blood pressure cuff on your registry. That's not sexy. It's not a onesie. Right? It's not a personal idea. But the reality is, I want you to know what your blood pressures are at home particularly because sometimes postpartum, after the birth, the blood pressure can go up. So I just want people to have access. If you don't have one, you can always go to your local pharmacy. I guarantee you they have one there, but how do we know it's the right size cup? So yes, I think people should be checking regularly. And what does that look like? Particularly if you have normal blood pressures, maybe that's once a week, right? And for somebody that's actually been diagnosed with chronic hypertension, maybe that's once a day. The problem is we call it the silent killer in healthcare because your blood pressures can be elevated and you could be asymptomatic, meaning you could not be bothered. So I think people assume, well, if I was at risk for a heart attack, surely I would have chest pain. Not exactly, right? So
Now, at what
like,
age should someone start regularly checking their blood pressure?
it's a good point. I mean, I don't know that you would need to do it maybe before your 20s. So maybe like 25 could be a good place to start. Because obviously children will get their blood pressures checked if there's concerns at the pediatrician's office, because I don't want to assume just because they're young, they're not at risk.
Right.
Right. But most, I would say young adults probably should be getting an evaluation at least. So you just kind of get into the habit of going, because think about it. A lot of young adults probably don't go to the doctor unless they're sick. But I would love to reverse that and say, no, start getting the care when you're like in college, because maybe something will be uncovered, but I pray not. Maybe this is just a good way of starting to navigate the healthcare system as an independent person without your parents or guardian. And then you can become accustomed to saying like, well, of course, we live in a very digital world now. And I think if we learned anything from COVID, doctors' offices might close. I pray there's never another global pandemic.
Right.
But I want people to be able to check their vital signs at home so they could report them to the doctor. So that's having a scale and a blood pressure cuff, because a blood pressure cuff will give you two vital signs, your pulse, which should be between 60 and 100 for adults, and a blood pressure.
Right. So doing those things is actually creating a baseline. So if you are of that age, you know your numbers, you can go to the doctor. So if they check your blood pressure when you go to the doctor on that annual visit, then you can say, oh, this is normal for me, or it's not normal. And then you're equipping and kind of managing the doctor a little bit to inform them of what, your typical numbers are.
I've had patients come in and say, no. I don't know that I can believe that number on your evaluation because this is what my data at home has been. And I'm like, that's helpful because again, I want to treat a pattern, not an outlier.
Mm-hmm. Yeah, I like that. And we talked a little bit about risk. Let's talk about symptoms. So what I've learned and heard is that symptoms of a heart attack are different between men and women. Is that the same for heart disease as well? So we can talk about those risks and then what the differences are for both heart attacks and heart disease.
So for a man, and what we're often taught like in medical school is people will say the signs of a heart attack include chest pain, jaw pain, maybe pain that radiates to the left shoulder, maybe getting what we call diaphoretic or sweaty. And that's important. Like, I think if truly you thought about it, if anybody was having those symptoms, you would know something's wrong and you should get it evaluated. But for women, it sometimes is more GI related. They'll complain of nausea or vomiting or heartburn. So it's quite dangerous to counsel folks like, only come into the ER if you're having chest pain. Well, a lot of times a woman will be like, well, no, I never had chest pain, but I had nausea a lot, or I had heartburn a lot. And I would submit, how do you tell the difference? How do you not panic? How do you know? So if you have heartburn and you take Tums and it doesn't get better, red flag, right? Like you're doing the antacid, you're taking the things that typically would resolve indigestion. If you said, oh, I stopped eating spicy food and I still had it, well, now that deserves a workup, right? I don't think we can assume anything. And you know what I also find that sometimes people do that's sweet but dangerous is they'll go to a doctor and say, hey, I'm having heartburn. So now you'll get this GI workup, which is okay, because maybe it'll get eliminated. But I would submit, don't go with a leading diagnosis. Just tell the doctor what you're feeling. Like, I get really winded after doing laundry. I can't climb the stairs as fast as I used to.
Right.
Or I'm feeling this heartburn all the time, even if I'm not, eating anything spicy. Because now that doctor's going to be able to come up with a differential diagnosis list, like their top things that they think it could be. But I think sometimes the people came in and said, I just don't feel well. I'm feeling really fatigued. I feel like if I get on an exercise bike, I can't even do 15 minutes. That's going to make them do a workup for your heart. And it's going to help them realize like, oh, maybe one of the symptoms is heartburn or indigestion, but I'm really worried about angina. That's our medical term for like basically not getting good blood flow to your heart.
Now, some of those risks and symptoms, if they go untreated, do they then become heart disease, or is heart disease more of a hereditary diagnosis?
That's a great question. People are having to take into account their family history. So I love it if people know, look, my grandmother had a heart attack at age 65, or my mom had a stroke at 35. I mean, that type of information is really helpful because it can help us direct your care. I don't know if you've ever thought about it, but a lot of women, if they're going to be at risk for heart disease, will develop those symptoms or have that diagnosis after menopause.
Interesting.
So there's something really protective of your cardiovascular system with estrogen. That's not why we would give someone estrogen or hormone replacement therapy after they have lost their ovarian hormones and start to complain of hot flashes and night sweats. But I do want people to take into account, it's very rare to hear about a woman having like a stroke or a heart attack before probably like age 50. And the average age for menopause in the United States is 51. But young people can be at risk. It's just probably not from the loss of estrogen. So for example, obesity or having a BMI greater than 30 kilograms per meter squared, unfortunately is rising in this country. And so even though you chronologically might be young, like 30, your metabolism or your body might think you're older because you have more adipose tissue or fat cells. So I always tell people your fat content or body fat percentage, which often gets measured, can be really dangerous. So we get more concerned if you have a lot of visceral fat, that's fat around organs, which you can't necessarily always see, right? Like people talk about like dress size. I don't know that I'm actually talking about that. I mean, the weight when you get on the scale is helpful, but it doesn't always discern your muscle mass versus your fat weight. So somebody could be muscular and weightlifting a lot and be quite fit, have a very low body fat, but they might still have a high BMI. So that's where sometimes the scale and the weight estimations can be a little bit misleading. But if someone's found to have like a really high body fat percentage and they have a lot of fat around their organs, that is a concern for developing heart disease, even at a younger age. Okay. So I would submit that we really need to pay attention to diet early on. Like, how are we feeding our kids? Because we're laying a foundation for things that they'll adopt in terms of being adults. I don't like diets and fads and things that you switch into or switch out of. Like, I'd rather find something that you could feel like you could eat or pursue in terms of nutrition for the rest of your life, right? Mm-hmm. So small changes make a big difference. I always reference a book I really like called Glucose Revolution by a biochemist named Jessie Inchance-Bay. She basically says we should eat vegetables first, proteins and fats second, and carbohydrates last. What I love about that is not a diet. She's just rearranging the order in which you should eat food. And she says the reason you should do that is fiber can't be digested by your body. It's just going to form a layer in your intestines. The foods that can be then digested, like steak, like mashed potatoes, those are going to be harder to absorb into your intestinal wall bloodstream because you started with the fiber. How easy is that? But if no one ever teaches you to eat your vegetables first, how would you know?
Right.
What she says that arrangement of food eating would do is it'll lower your blood sugars. And I think a lot of people don't realize there's a link between blood sugars and fat gains, because the blood sugars will just convert to fat if you're not exercising or burning off that energy. But also, I think people don't realize there's a link between blood sugars and cholesterol. And we know that unfortunately, cholesterol can form plaques in our blood vessels that can lead to heart attacks or strokes over time. So I think to answer your question, a lot of people assume they're not at risk for heart disease until they're of old age. But I would submit that the foundation for that heart disease is laid out as a child, as a teen. So staying physically active, I tell people try to exercise 30 minutes a day. If that feels overwhelming, do 10 minutes in the morning, 10 minutes on your lunch break, 10 minutes after your evening meal. Get into the habit of moving your body, because I feel like food can be medicine, but I feel like movement can be medicine too. So while heart disease can seem really overwhelming and, oh, okay, everybody in my family has high blood pressure and my grandmama then, they all died of heart attacks. Well, we can do something different. We can break those generational curses by being proactive. Let's pursue the preventative care.
Yep. Yep. I like that. And the other thing that comes to mind is that all of these things are related, it seems. So you talked about cholesterol, stroke, heart disease, high blood pressure, heart attacks.
Right.
So those are outcomes, but we can control those outcomes by creating a lifestyle that will prevent some of those things from happening. And it doesn't sound like they're drastic. The things that you mentioned seem very simple. You know, having vegetables on your plate, eating those vegetables first. You know, a 10-minute workout. You know, I think I can do that. Like that seems very, very doable.
Meet people where they're at. Not everybody go get exercise equipment or join a gym. That could be very costly. Do you live in a neighborhood where it's safe to walk outside? Right. So I try to meet people where they are. If you don't have any dumbbells at home, use a can of peas. You know, do some weightlifting with that can of peas during a commercial break. Right.
Yeah.
That type of thing. Sometimes food that is cheap or financially more affordable can be densely packed with calories and have a really long shelf life. So ultimately it's not good for us in the end. So I just want people mindful about what you're putting into your body. You know, people will be very mindful about the makeup they put on their face or the grade of gas they put in their car. I mean, what if we treated our bodies like that, right? Like, what if we said, this is a vessel, I'm going to treat it like a temple.
Exactly.
Respecting the temple, right? So don't disrespect the temple with like food that's not so great, right?
Yeah.
Doesn't mean that you can't enjoy a piece of cake on your birthday. No, enjoy your birthday. Life is short.
Right.
That means you shouldn't be eating cake on a day-to-day basis, right? That type of thing.
Everything in moderation.
Everything in moderation. Absolutely.
Now, one of the things that I learned in speaking with you earlier is about breastfeeding. Can you talk a little bit more about mothers who breastfeed their children and the impact of that on their heart health?
Yes, I think it grossly gets overlooked, the power of breastfeeding for protecting mom. People talk a lot about how breastfeeding is good for baby, right? So we know from research that breastfeeding your infant can lower their risk for heart disease, lower their likelihood of obesity, lower their risk for eczema, etc. But I always tell people there's a lot of data to say if a mom breastfeeds or pumps, I think of those as similar, for at least 12 months, she'll lower her risk not only for breast cancer, uterine cancer, and ovarian cancer, but also type 2 diabetes and chronic hypertension. Excuse me? I feel like if I put all of that in a bottle, it would sell out, right?
Exactly. I buy it for sure.
Lower your risk for chronic hypertension by breastfeeding your baby. So when you have the opportunity to breastfeed, it's really pouring into your spirit and that it's going to lower your risk for heart disease long term. So I love that it's for mom and baby. And I think we don't talk enough about that as a community, that breastfeed is not always easy, but it's worth it. And if you're having a struggle, partner with a lactation consultant. Commit to doing breastfeeding exclusively if you can. I think it's a really great tool. And I think it's how we save more Black moms from the Black maternal mortality crisis, right?
Oh, yes. And that's a whole
another
epidemic.
The whole of the podcast, right?
It is. We'll have you back to talk about that. So what I've learned and heard from you is that at every stage of our life, let's say starting in our 20s, we should take into consideration certain things about our lifestyle in order to protect us from the impacts of heart disease and to make sure that we are promoting a healthy heart within ourselves. And so what I like to say, we're creating these micro moments, we're doing these very micro steps that become a part of our lifestyle so that as we get older, they become just second nature. And if you do have any issues, you at least know, your numbers, your baseline, and then you can talk to your healthcare professional and be really educated about you as a person and partner with, your healthcare professional to help you.
Absolutely. And I would say, we talked a little bit about nutrition, exercise, knowing your family history. I think one of the things we haven't talked about is stress. Sometimes you can't stop the stressors around you, but you can change how you respond. And I think that's definitely something to learn early on. That's going to be worth its weight in gold.
Mm-hmm. And being mindful about the impacts of those things and how they impact you.
Mm-hmm. Like, I remember talking to you and you said, oh, I'm going to go do yoga. And I was like, yes, do that, right? One of the things I love about yoga is how many exercises do you know where you can calm the mind, right? You see people sleeping at the end of a yoga class, but then be getting physically stronger. Like, to hold some of those yoga poses takes a lot of muscle strength. So when you're running on a treadmill, that is improving your cardiovascular health. You're increasing your heart rate. You are sending blood to the muscles. But from a stress standpoint, does your body not know you're not running from a bear? Mm-hmm. Right? So, it can cause a little bit of stress. So that just shows you, like, everything in moderation. Like, okay to be on a treadmill, okay to lift some weights, okay to do some mindful activities like yoga. Yeah. But I just want people to lose sight of how important it is to be able to manage your stress, because it may not matter what you're eating or how much you're exercising if you're allowing that chronic tension to be in your body. Cortisol is a stress hormone that spikes often in the middle of the night. That's when it peaks. So I always tell people, if you're not getting quality sleep of at least 7 to 8 hours, that's ultimately going to hurt your cardiovascular health too. We've seen a lot of people have elevated blood pressures or elevated blood sugars because they're not getting good sleep. So it just shows you how it's all one body. It doesn't profit you to eat well and exercise, but stay up all night. It doesn't profit you to go to church and pray, but then be worried. You can't do both. Either you pray, you give it up and leave it at the altar, or you say, I'm just going to be stressed about it. No, that stress, we hold it in our bodies. Mm-hmm. And it can be really toxic. I see this a lot from a fertility standpoint. So I get worried that we are going to be seeing more and more women at risk for heart disease because they are not handling the stress. And it's going to look different from everybody. If yoga is not your thing, you don't want to meditate, would you draw? Would you give
find what works for you?
Mm-hmm. Call a friend you haven't talked to in a long time. I think whatever's going to work for you to calm your spirit, even if it was just 10 minutes a day, it's going to be worthwhile because it's going to be cumulative over time.
Right. And one of the things I've tried to do is just pause. So even if I feel the stress in my body, I may not know what the cause is right away. But if I pause and think about what was a trigger, did somebody call? Is there something that I'm thinking about that is causing me to become stressed? Maybe I'm worrying about something. But as long as I am mindful about what I'm feeling and then can take that moment to pause and think about it and then redirect.
Love it.
Then I feel a lot better. Like, my stress is coming down, because I definitely don't want to be in that fight or flight mode all day. And then if I'm not sleeping, again, that fight or flight mode is on overdrive at that point too. So it's not doing my body any good if I am living a life of stress and then my sleep habits are awful. And so, that's stressful as well. So I think being mindful is really about, just taking a pause and understanding what your body is going through and trying to redirect that stress or eliminate it in whatever way works for you, whether it's yoga or a walk or coloring. Find what that thing is for you to stop being stressed.
Right. Mm-hmm. I think you have to cultivate your garden. Like, what's going to help you be the best version of you? And like you said, I don't think the fight or flight mechanism was ever meant to be done long term. But we have to quiet those sounds in our head to say, this should be alarming. And I think the scary thing is too, people scroll on social media. People watch the news. There's always alarms. So you almost have to disconnect.
Create some boundaries, right?
Yeah. healthy boundaries. Sometimes that means removing toxic people from your life, which can be hard. Sometimes that might mean leaving a job. Sometimes that might mean having a very uncomfortable conversation with folks. But I find that if you don't do it, you'll pay the price. You'll ultimately be putting yourself at risk for heart disease because you didn't set those healthy boundaries. I love those people that say, like, a no is a complete sentence.
Sure is.
A no is right? Like, you're like, oh, I don't want to hurt their feelings. You're kind, you're sweet, right? But the reality is, if a no protects you, you got to protect your peace first. No one's going to do it for you, you know?
Exactly. And give from your overflow. I think that's also important in setting boundaries. So if I'm constantly giving to everyone else, fixing everyone else's problems, if I'm the go-to person in my family because I'm the matriarch and everybody's coming and dumping their issues on me because they want my advice, that's not going to serve me well in the end. Because then when I'm done helping everyone else and everyone else is happy, like, what about me? What do I have left for myself? So some of that is really being mindful and conscious of how much we pour into others without leaving anything for ourselves.
I think what you're getting at is it's self-care, right? Self-care is not selfish. I always tell people you can't pour from an empty cup, right?
Right.
When you get on a flight, they say, put the mask on yourself and then put the mask on the person next to you if they need help. But you're not going to be very useful to them or helpful to them if you're not thriving yourself. And so I think it definitely makes sense. And there's a lot of data to say you will protect your heart by being mindful and protecting yourself. There's a lovely study that talks about a gratitude journal. So they took these patients who had heart failure, which is quite serious, right? Some people with heart failure might need a heart transplant. And they had them write down each night, like 3 things they were grateful for. And they had better outcomes. So here they
Power of gratitude.
Isn't that amazing? So it just shows you like there's something really special about reducing the toxicity in your life and being really grateful and content for what you have, but taking the time. Because I think people might be low-key grateful, but I don't know that they always take the time to write down what they're grateful for.
Yes. And just like we have to pause to figure out the stress, maybe also pause to figure out why we're happy. If you're experiencing a joyful moment, pause and express that gratitude. Or at night, talk about or write down the things that you are grateful for. Because I actually believe that the more that you show that you're grateful for those things in your life, or maybe something that has happened in your life on that day, then you're attracting more of those things to happen to you.
Wholeheartedly.
And so I think I love that. It's definitely important to show that gratitude.
I think every one of us knows that person where it always feels like the sky is falling.
Yes.
Well, it's sometimes just hard to be around those folks because you're like, I don't need them bringing me down today. And what they might be spitting are facts, right? Like there could be like literal disaster around us, but there's always a silver lining. There's always a but God moment. And I feel like you're really going to make a situation that maybe is already bad worse by just taking that perspective. So I love that you're talking about taking the pause and then just saying like, but at least we have this. Well, I'm so grateful for that. Mm-hmm. And how can that not slow down your heart rate? How can that not lower your blood pressure? So you don't even realize that you're inadvertently protecting your heart by doing those things. One of the things I really like about meditation is studies have shown it'll lower anxiety and it'll lower blood pressure. That's not even medicine, but that's literally the goodness that can come out by just taking the time. You can do guided meditations. You can do meditations by yourself. But like, what if you did 10 minutes a day? Like that would be life-changing over time, Absolutely. So there's science behind it. There's science to support it.
Yes. I love all of this. And I've really appreciated this conversation. In my work as a concierge and personal assistant, my work is to make sure that my clients are taking care of themselves. So whether that's making their doctor's appointments. So if you're listening to this and you and you don't have a concierge or a personal assistant, just make sure that you're staying on top of those things that are going to be beneficial for you to make sure you're fostering that lifestyle that is going to protect your heart health. So whether that is making your appointments or setting up time to exercise, making sure you're being mindful, building those things in your calendar. And again, a couple podcast episodes ago, we talked about creating systems. And
Right.
so scheduling it is a big thing for me. If it's on the calendar or if I'm paying for it, I'm typically there. So if I have to pay for a class, if I have to pay for yoga, when we got off the phone the other day, I was like, all right, it's 2:00. I have to make it to yoga class because I paid for it.
Right.
So,
That's for you.
the value, exactly. So whether you have an assistant or not, I think there are things that you should put in place in your life to make them automatic. How do you make sure that you are going to pause? Is it having that gratitude journal at your bedside? So before you cut off the light at night, you can at least write that one thing down. What are the things? Can you set an alarm on your phone that says, take a 10-minute walk?
Yeah.
To do that. So what are those things in your life that either you or your assistant can help you with?
For sure. Like, I love that's the work that you do, because I think so many people think they have to do it all. And I tell people, like, sure, I can do all things through Christ who strengthens me, but I don't have to. Like, delegate the task, my friend, right?
Absolutely.
And I think you can really spin your wheels and try to find that 25th hour in the day that doesn't exist. Or you can say, what do I have to do now? What could I do later? And what could I give away to someone else to do? That kind of compartmentalizing, because otherwise you'll feel like everything's due at this time. I have to do everything right now. I can't get any sleep. I can't rest, because no, why don't we prioritize the rest? Why don't we say, like, I'm going to hire someone to do this. I'm going to decline that party, even though a party sounds fun, but I need rest, right? So I think it's sometimes those judgments that can make or break someone, right? So
Yeah,
be,
absolutely.
be thoughtful about your schedule. And if you have a schedule, you'll know if you've overbooked yourself, as I sometimes do. Full closure, guilty of that. Or you'll say, there's actually a day where I don't have much going on. And that's not laziness. That's me protecting my peace,
Absolutely. Absolutely. Now, what are the things that we should look for if we're looking for a healthcare provider? And where can we find those resources? Do you have any tips for the audience on finding a good one?
I always think a good place to start is the community. Ask your friends, do they like their doctor? Go on those Facebook groups. Just for example, here in town, there's a local neighborhood Facebook group called Melanin Moms of Pearland. I'm going to shout them out because they send me a whole lot of patients.
I love it.
And what I like about it is it's like an Angie's List for Black women that happen to live nearby. And when I was starting off my practice, if somebody was like, hey, I'm looking for OBGYN, I would type in the chat, hey, happy to see you. I'm located here. Call me. Well, now when I run to the comments, my patients have already showed up. They're like, oh, come see Dr. Silas. So I just feel like people won't set you up for failure, right? I read a doctor's bio. They seem really nice on their Google reviews, right? But I feel like the people have no reason to sugarcoat. So if you've got a good pediatrician, you got a good primary care doctor, a lovely dentist, usually the people will tell you, they'll be like, girl, use my person. But what if if you're new to town, you don't know anybody, things like that. I always say, usually where you find one good doctor, you'll find another. So let's say you check with your insurance and you found this primary care doctor was in network, and you go see that person and you say, hey, I really need a dermatologist. Ask them. Hopefully they won't set you for failure. You feel like they were a good doc, they're well trained, they board certified. They're going to send me somewhere else that's really good.
Right.
But shoot, I think a lot of people don't realize this. If your doctor is board certified, then that means they get a medical license from the state. You can go on the state medical board's website and see, does that doctor have a lot of complaints? That's
I didn't know that.
Information. Yeah. So sometimes you just want to fact check folks. They might be lovely in the comments or the community, but you just want to make sure that they know the science, that they're doing the training, that they're, taking good care of folks too. So that's probably my top 3 ways. So like word of mouth, even if that's by the internet, check in with a doctor you love and trust, because hopefully their referrals are amazing. And then 3, like check in with the state medical board can be really helpful.
Awesome. That is so amazing. Thank you so much for being here. Can you tell the audience where we can find you, whether it's local to your state or even on your social media pages?
For sure. We would love to see you at Bella Obstetrics and Gynecology. That's where I practice. I am specifically located at our Pearland location. And know that we have 3 locations for those that live in the greater Houston, Texas area. So 1 near Galleria, 1 in Medical Center. And then, like I said, I'm at the Pearland office. Our phone number is 713-373-4100. And you can always find us on our website, www.bellaobgyn.com. I personally have a blog that I would love to interact with you on Instagram. It's @ Joy and Pain blog, all lowercase, all one word. And basically that's just my forum to talk about reducing Black maternal mortality. But I feel like this conversation fits in alignment because in my mind, it's not just about having women die in pregnancy or postpartum, although we have to lower the peripartum deaths. It's really about women not just surviving, but thriving. So I care equally about their pre-pregnancy life and their post-pregnancy life, meaning at some point, they will not be in their reproductive years. But I want those women who have children to bounce their grandchildren on their knee. So we have to reduce the heart disease risk in order to see those golden years, right? I want women to know that there's something you can do on a day-to-day basis to build up your stamina. Whenever you see someone that's thriving in their older age, pull them to the side and ask them, how'd you do it? How'd you get there? Right? So that's how we can kind of help keep those good vibes going. So yeah, I want to be your partner in wellness. Come join us. Come hang out. Come visit the club.
I love that. I love that. Well, once again, thank you so much for being here. To our audience, make sure you follow Dr. Silas, and we will see you next time. Be well and be balanced.
Thank you.
Thank you for joining me this week. Let's continue the conversation on social media at 1 Minute with Monet on all channels. Also, don't forget to like, follow, and subscribe to our podcast on your favorite platform.